Is coffee a friend or foe of the heart? Hello, I'm Dr. Habibi, a cardiologist. Today, I want to talk with you about one of the world's most popular drinks, coffee. One of the questions patients often ask us is coffee ultimately good for our heart or not? Should we drink coffee or avoid it? To give a brief and concise answer, coffee is beneficial for our heart because it can both reduce heart attacks and strokes. It reduces strokes, and it also leads to a decrease in heart failure and a reduction in arrhythmias. Now, the question arises, how much coffee are we allowed to consume per day? In these large studies that have been conducted, drinking between 3 to 5 cups of coffee per day is beneficial for the heart and reduces cardiovascular complications. But if you drink more than 5 cups, it can itself cause a series of side effects. And even for people who are healthy and have no heart problems, we recommend consuming a maximum of 5 cups. And the best time to drink coffee is in the morning and before noon. Now, you might ask whether these beneficial effects apply to a healthy person only, or if someone who has had a heart attack, someone with blocked heart vessels, someone who has had a stent, or someone with irregular heartbeats is also allowed to drink coffee. To answer this question accurately and scientifically, we need to know what coffee contains. Coffee has 3 main components: caffeine, polyphenols, and terpenes. If you found the content of this video useful, please like it and share it with your friends. And if you don't want to miss my next videos, please subscribe. Polyphenol is an antioxidant, and it's a very powerful antioxidant, meaning it has protective effects for our cardiovascular system. It both improves heart function and strengthens the vascular system, and as a result, it reduces the risk of diabetes. So many of the beneficial effects of coffee that have been shown in studies and proven in research are because of these polyphenols. But what about caffeine? Caffeine is a stimulant for the nervous system, and that's why it increases both heart rate and blood pressure. It raises them a bit, so for people who have heart palpitations, people who suffer from stress and anxiety, or those with high blood pressure may experience side effects from drinking coffee. But the good news is that people who drink coffee regularly and daily, after a while their bodies get used to it and they no longer experience these side effects. As we mentioned, because caffeine is a stimulant, it can lead to sleep disturbances. That means people who consume caffeine usually experience lack of sleep or insomnia, and many use it specifically to stay awake, but this same caffeine can also increase stress and anxiety. Therefore, we recommend that those who want to have a good night's sleep, or need more sleep, or are experiencing stress, should reduce their intake of coffee and similar caffeinated drinks, or if they do consume them, avoid drinking coffee at night and instead have it in the morning. But another compound found in coffee is terpene. Terpene is a compound that can cause an increase in harmful blood lipids, meaning it contributes to elevated cholesterol levels. Therefore, people who have high blood lipids should consume it with caution, and those with a history of clogged heart arteries should also be careful. But the good news is that this substance can be separated out from coffee, meaning when coffee is being processed, or in other words, when it is being brewed. We can use certain paper filters that block this harmful lipid and prevent it from entering the coffee. And for this reason, it prevents the heart-related side effects and other complications caused by this harmful substance. Coffee from which terpenes have been removed is called filtered coffee. That's why we recommend that people with heart problems and even healthy individuals use this method to avoid these side effects. The coffee we recommend is filtered coffee. So how can you find filtered coffee? Some types of filtered coffee include Nescafe, Milano, or plain black coffee. On the other hand, cappuccino, latte, and espresso are unfiltered coffees. That's why those negative effects we mentioned, which can lead to increased blood lipids and heart complications, are caused by these types of coffee. The second point is about coffee additives. Make sure the coffee you consume is completely filtered and does not contain that particular substance. Because a number of additives are added to it, like sugar, cream, whipped milk, or frothed milk, and these are harmful to your cardiovascular system. So if you are going to drink coffee, first make sure it is filtered, and second, that it doesn't contain these additives. In other words, drink your coffee plain and without sugar. Another question that is often asked is whether we should use Arabica coffee or Robusta coffee. Both of these contain caffeine, but Arabica coffee has more caffeine, is more popular, and is more expensive. However, what determines whether it is harmful or not for our heart is something else. The issue of whether the coffee is filtered or not is important, because when we say Arabica or Robusta coffee, we are referring to the coffee bean itself, and that alone does not determine its harm. If either of these coffee beans is filtered, their negative effects on the heart are reduced. So it really doesn't matter which type of coffee you use. What matters is that it is filtered and also that it is consumed without sugar and without additives. And finally, can elderly people also drink coffee? Yes, drinking coffee itself leads to a reduction in cognitive decline and a decrease in Alzheimer's disease. Therefore, even people over 70 years old can easily drink coffee provided that they follow the conditions we mentioned. Now, regarding pregnant women, we recommend that pregnant women either do not drink coffee, or if they want to consume it, they should do so in small amounts, meaning at most 1 or 2 cups per day. Because excessive coffee consumption in pregnant women can lead to fetal complications. So this should also be kept in mind. Another point is that some types of coffee, like Turkish coffee and French coffee, have the highest levels of harmful substances called diterpenes. For this reason, we strongly advise patients with heart problems should not consume these types of coffee, and even healthy individuals, because even for them it can be harmful. The final word and last message is that the next time you go to a coffee shop or want to order coffee, the best coffee for your heart is plain black coffee without sugar, and you should avoid ordering lattes, cappuccinos, and espressos because they are unfiltered and contain additives. So the final point is that coffee is a friend to the heart. Ours.